Are you suffering from eye conditions like glaucoma or ocular hypertension? If so, you may have come across the medication called Brimonidine. But what is Brimonidine used for, and how does it work? Main indications for Brimonidine. Brimonidine is primarily used to lower the pressure inside the eye, making it an effective treatment for certain eye conditions. The two main indications for Brimonidine are glaucoma and ocular hypertension. Glaucoma is a group of eye diseases that can cause damage to the optic nerve and lead to vision loss if left untreated. It is often associated with increased pressure inside the eye, known as intraocular pressure. Brimonidine works by reducing the production of fluid in the eye and increasing the outflow of fluid, thus lowering the intraocular pressure and preventing further damage to the optic nerve. Ocular hypertension, on the other hand, refers to increased pressure inside the eye without any signs of optic nerve damage or vision loss. If left untreated, ocular hypertension can progress to glaucoma. Brimonidine can be prescribed to individuals with ocular hypertension to help lower their intraocular pressure and reduce the risk of developing glaucoma. Dosing information for Brimonidine. The appropriate dosage of Brimonidine will vary depending on several factors, including your age, medical condition, and response to treatment. It is important to follow your doctor's instructions and use the medication as directed. Brimonidine is available in the form of eye drops, and the usual recommended dose for adults with glaucoma or ocular hypertension is 1 drop in the affected eyes 3 times a day. Your doctor may adjust the dosage if necessary to achieve the desired reduction in intraocular pressure. For children, the dosage of Brimonidine may be different and should be determined by a pediatric specialist based on the child's age, weight, and individual circumstances. It is important to use the eye drops exactly as prescribed and to avoid touching the tip of the dropper to any surface to prevent contamination. If you wear contact lenses, you should remove them before using Brimonidine and wait at least 15 minutes before reinserting them. Common side effects of Brimonidine. Like any medication, Brimonidine may cause side effects in some individuals. However, not everyone will experience these side effects, and they may vary in severity. It is important to discuss potential side effects with your healthcare provider before starting Brimonidine. Common side effects of Brimonidine include dry mouth. Some individuals may experience a dry or bitter taste in the mouth after using Brimonidine. This side effect is usually mild and temporary. Dry eyes. Brimonidine may cause temporary dryness or discomfort in the eyes. Using artificial tears or lubricating eye drops can help alleviate this symptom. Allergic reactions. In rare cases, Brimonidine may cause an allergic reaction. Symptoms of an allergic reaction may include itching, redness, swelling, or rash. If you experience any signs of an allergic reaction, seek immediate medical attention. Changes in vision. Brimonidine may cause blurred vision or other changes in vision. If you experience any significant changes in your vision while using Brimonidine, consult your doctor. It is important to note that this is not an exhaustive list of side effects, and other side effects may occur. If you experience any unusual or bothersome side effects while using Brimonidine, contact your healthcare provider for further guidance. User testimonials and experiences with Brimonidine. To get a better idea of how Brimonidine has worked for others, reading user testimonials and experiences can provide valuable insights. It is important to remember that individual experiences may vary, and what works for one person may not work for another. However, user testimonials can give you a general sense of the effectiveness and potential side effects of Brimonidine. Users have reported positive experiences with Brimonidine, noting a significant reduction in intraocular pressure and improved eye health. Many have found Brimonidine to be easy to use and well tolerated, with minimal side effects. Some users have also mentioned that Brimonidine has helped them avoid further damage to their optic nerve and preserve their vision. However, it is important to keep in mind that not all user experiences will be positive. Some individuals may not respond well to Brimonidine or may experience side effects that affect their quality of life. It is crucial to consult with your healthcare provider to determine if Brimonidine is the right treatment option for you and to discuss any concerns or questions you may have. Precautions and contraindications for using Brimonidine. While Brimonidine can be an effective treatment for glaucoma and ocular hypertension, there are certain precautions and contraindications to consider before starting this medication. Brimonidine should not be used by individuals who are allergic to it or any of its components. It is important to inform your doctor about any known allergies or sensitivities before starting Brimonidine. You should also inform your healthcare provider about any other medications you are taking, as certain medications may interact with Brimonidine and affect its effectiveness or increase the risk of side effects. This includes both prescription and over-the-counter medications, as well as herbal supplements. If you have certain medical conditions, such as low blood pressure or cardiovascular disease, your doctor may need to adjust the dosage or monitor your condition more closely while using Brimonidine. It is important to provide a comprehensive medical history to your healthcare provider to ensure the safe and appropriate use of Brimonidine. Alternatives to Brimonidine for similar indications. While Brimonidine is commonly prescribed for glaucoma and ocular hypertension, there are other medications available that can be used as alternatives or in combination with Brimonidine. One common alternative is a class of medications called beta blockers, which also work to lower intraocular pressure. Beta blockers can be used alone or in combination with Brimonidine, depending on the individual's specific needs and response to treatment. Another alternative is prostaglandin analogs, which are medications that help increase the outflow of fluid from the eye. Prostaglandin analogs are often used as a first-line treatment for glaucoma and can be effective in reducing intraocular pressure. Carbonic anhydrase inhibitors are another option for lowering intraocular pressure. These medications work by reducing the production of fluid in the eye. They can be used alone or in combination with other medications, including Brimonidine. It is important to discuss with your healthcare provider the best treatment options for your specific condition and individual circumstances. They will consider factors such as your medical history, response to treatment, and potential side effects to determine the most suitable medication or combination of medications for you. Frequently asked questions about Brimonidine. Can Brimonidine be used during pregnancy or breastfeeding? The safety of Brimonidine during pregnancy and breastfeeding has not been well established. It is important to consult with your healthcare provider before using Brimonidine if you are pregnant, planning to become pregnant, or breastfeeding. Can Brimonidine be used in children? Brimonidine can be used in children, but the dosage and administration should be determined by a pediatric specialist based on the child's age, weight, and individual circumstances. How long does it take for Brimonidine to work? The onset of action of Brimonidine may vary among individuals. Some individuals may experience a reduction in intraocular pressure within hours, while others may require several weeks of treatment to see significant results. It is important to follow your doctor's instructions and continue using Brimonidine as directed. Can Brimonidine be used with contact lenses? If you wear contact lenses, it is recommended to remove them before using Brimonidine. You should wait at least 15 minutes after using the eye drops before reinserting your contact lenses. Can Brimonidine be used with other eye drops? Brimonidine can be used in combination with other eye drops, but it is important to follow your doctor's instructions and separate the administration of different eye drops by at least 5 minutes to prevent potential interactions. Consult your healthcare provider before using Brimonidine. Before starting Brimonidine or any other medication, it is crucial to consult with your healthcare provider. They will be able to assess your specific condition, provide personalized dosing information, and discuss any potential side effects or concerns. Your healthcare provider will consider factors such as your medical history, current medications, and individual circumstances to determine if Brimonidine is the right treatment option for you. They will also provide instructions on how to use the medication correctly and monitor your response to treatment. Remember that self-diagnosis and self-medication are not recommended. Your healthcare provider is the best source of information and guidance when it comes to your health and the appropriate use of medications. Conclusion and final thoughts. Brimonidine is a medication used to lower eye pressure, primarily prescribed for glaucoma and ocular hypertension. By reducing the production and increasing the outflow of fluid from the eye, Brimonidine helps alleviate the pressure and prevent damage to the optic nerve. When using Brimonidine, it is important to follow your doctor's instructions and use the medication as directed. Discuss potential side effects with your healthcare provider and report any unusual or bothersome symptoms. User testimonials can provide insights into the experiences of others with Brimonidine, but individual responses to the medication may vary. Consult with your healthcare provider to determine if Brimonidine is the right treatment option for you and to address any concerns or questions you may have. As with any medication, there are precautions and contraindications to consider before starting Brimonidine. Inform your healthcare provider about any known allergies, other medications you are taking, and any medical conditions you have. Alternatives to Brimonidine are available for similar indications, and your healthcare provider will determine the most suitable treatment plan for you. Remember to consult with your healthcare provider before starting Brimonidine or any other medication. They will provide personalized dosing information and ensure the safe and appropriate use of the medication for your specific condition. Your eye health is important, and your healthcare provider is there to guide you on your journey to optimal eye care.